Pelvic floor disorders affect millions, and the symptoms that come along with those issues can be incredibly frustrating. So in today's How It Works, I'm going to learn about a therapy that can make a big difference. I think, Angela, we should start by just explaining what this therapy is all about.
Well, pelvic floor therapy really is a type of therapy that can address the muscles at the bottom of the pelvis. Some people don't know, but we actually have muscles in our pelvis, and because physical therapists specialize in treating muscles, you go to physical therapy to get that area stronger as well.
So let's talk about who would benefit from pelvic floor muscle therapy.
There's so many different patients that have symptoms that might benefit. Symptoms such as leaking when you cough or sneeze, having to run to the bathroom to get there in time, getting up at night multiple times to go to the bathroom, having difficulty controlling gas.
So can this pelvic floor therapy really help the issues? Is there hope for people?
Absolutely. Just like any other issue, if you have weakness of muscles and they're not doing their thing, you strengthen them and you often can get rid of your symptoms. Generally, when we see patients, we explain to them that it's not just your pelvic floor that's having a problem. A lot of times there's core muscles that aren't doing their job, and there's also pelvic girdle muscles that aren't doing their job. And all of that has to work together for your pelvic floor to really be as efficient as it needs to be so that you don't have any symptoms.
I think the first and most important thing is to talk about it.
Correct. It's very common, but most women don't know this. If you look at the entire population from age 20 to 100, 25% of women are going to have pelvic floor dysfunction.
So today you're going to show us a couple of exercises that can help strengthen those muscles.
Correct. We want to be able to use the Swiss ball, that's what these are called, Swiss balls, to put a little bit of pressure at your pelvic floor to help you do a Kegel.
Okay.
A Kegel is just another word for a pelvic floor muscle contraction. So if we want to strengthen our pelvic floor, this is a nice way to start. Lift your pelvic floor, and some people say, what does that mean?
Right.
But if you picture yourself going to the bathroom and you try and stop your urine flow, you're going to hold that contraction as you glide over onto your right leg and back to center, and glide onto your left leg and back to center.
Angela grabbed some bands for the next one.
Now we're going to get some pelvic girdle muscle strength. So you're going to tie this around your knees and you're going to put your feet and knees together.
Okay.
And in that position, you're going to try and pull outward on the band, and you're going to hold that for a count of 10. So the last exercise I want to show you is a really important exercise for using your abdominals correctly that will help your pelvic floor be stronger.
Okay.
So the trick with this is letting your tummy hang to start. And then the exercise is just to draw it inward and hold. And as you hold that, you might even feel your pelvic floor muscle tensing a little bit because the two of them work together. After 10 seconds, you can just relax. And you'll also relax for 10 seconds.
Okay.
It takes practice. When you start new exercises, it really takes practice to get good at them. And as your muscles get stronger, you do get good at them, and then you should start seeing some improvement in your symptoms.
And so that's the best thing about pelvic floor muscle therapy, is that there is hope.
These are things you can try in your home. These are things you can try with the help of a therapist if needed, but they're simple things to do, and they can make a real big difference in the quality of your life as they get your symptoms better.
Angela, thank you so much. For more information on other therapies, just head to our website, livinghealthytv.com.